Have you been wondering whether you should sign up for Part D or how and when to sign up for Part D? And so you're not alone. Part D can be one of the most confusing Medicare programs for many people. Hi there, if we haven't met yet, this is Chris Dewey with May River Medicare. In this video, I'm going to explain what Part D is, why you should consider signing up for it, and how to avoid paying those late penalties. Medicare Part D is a voluntary prescription drug program, helps reduce the cost of medications that you can pick up either at the pharmacy or via mail order programs. Part D plans are offered by private insurance companies in each state, so you won't sign up for Part D at the Social Security office like you do Part A and Part B. You're eligible to enroll in Part D if you have either Part A or B and if you live in a planned service area. So there's no health questions asked on a Part D application. Everyone on Medicare is entitled to enroll during a valid enrollment period. Now let's talk about when to enroll and why. Your initial enrollment period for Part D is the same 7-month window as your initial enrollment period for Medicare. It begins 3 months before your 65th birthday, the month of, and 3 months after your 65th birthday. This is when most people enroll in Part D, unless they have credible coverage from an employer or a source like the VA. Technically, Part D is voluntary. No one knows when they're going to get sick or need expensive medications, so Medicare encourages your enrollment at age 65 by imposing late penalties for late enrollment. If you don't have any other credible drug coverage and you miss those 7-month initial enrollment period, you will start accumulating a penalty that gets larger with time. Penalty accrues at 1% at the national average premium per month for every month that you could have been enrolled in Part D but were not. For example, let's say you decided not to enroll. Maybe you're currently not taking any medications or they're cheap generics, really inexpensive. If you were to wait 5 years to enroll, you would pay a 60% higher premium as your penalty. And you'll pay that for life. As long as you remain on Part D, you'll pay that penalty. Fortunately, in most states, you can get a Part D drug plan very inexpensively so that you have coverage in case you need it. Delaying your enrollment is risky because once your initial enrollment period passes, you can only enroll in Part D during a valid election period. Medicare gives all beneficiaries an annual election period each fall from October 15th to December 7th to join a plan that will start the following January. If you skipped enrolling when you were first eligible, and then 1 year in February, your doctor prescribes a $400 medication, you're going to have to wait nearly a year before you can get coverage. I had a client when I worked for Humana years ago. I signed him up on the Humana Medicare Advantage plan, and he got the Medicare Advantage plan with no drugs included. I highly recommended to him to get a drug plan because of the Part D penalty, because even though he was healthy and didn't take any medications at the time, down the road we don't have a crystal ball. We don't know what's going to happen. So anyway, got a call about a year ago. This was 2010 when I worked for, back when I was a career agent. I was an employee for Humana. Signed him up on it, persuaded him to get the Part D drug plan. He didn't listen to me. And what happened was I got a call from his wife about a year ago. It was August. And she said he's got cancer. He's got, not only does he have cancer, his lymph nodes, but it had spread into his brain. And he had to take thousands, like one medication cost him thousands a month. All right, so he was up, he was up the creek with no paddle. And what happened was I actually was able to go through the drug company itself to get him some assistance, but he still paid thousands. And signed him up on a drug plan in October, but that didn't kick in till January. So for a few months, for the first month, he paid, I don't know, it was like $3,000 in drugs. And then I was able to get the drug company, and plus he reached a catastrophic stage, which is a video for a different day. He went through the donut hole, went through the catastrophic stage, but it ended up costing him thousands. Not to mention he had hospital copays, outpatient chemo copays. So in addition, you got to think about the penalty that he received. 9 years of no Part D plan times 12 months a year comes out to 108 months times the average cost of a Part D drug plan. Let's do the math here. Is $34. So it comes out to $36.72 a month for the rest of his life. Every month, he had to pay an extra $36.72 for his drug plan. And he's hanging in there. I think he's going to make it. He said, Chris, I've got cancer. I want a Medicare supplement. I don't want the Advantage plan anymore. I want the supplement. Well, unfortunately, I was able to get him an Advantage plan with a drug plan in it. So instead of a Medicare Advantage only, I got him a Medicare Advantage plus the drug plan built in. He wanted a supplement. I had to explain to him, you can't get a supplement. You are stuck with an Advantage plan because you can't pass underwriting. 6 months after you turn 65, folks, you're done. If you get sick with cancer or something serious, or you take a drug that's on the insurance company's bad drug list, you can't just get a supplement. So even though he'd love a supplement so he could go down to the Mayo Clinic or MD Anderson or a special cancer institute, he's got to go to either Candler or Memorial to get his cancer treatment. Both good hospitals, but he wanted to go to MD Anderson. You can't do that unless you can pass underwriting. So I think there's a loophole that I can get him a supplement next year, but we're working on that. And anyway, these are things you want to think about when you turn 65. Okay, you don't want to pay these out-of-pocket expenses for 1 month, 11 months, no months at all. So in my opinion, that's one of the most compelling reasons to enroll and protect yourself with Part D. Now let's move on to see how do you enroll in Part D. As I mentioned earlier, Medicare Part D is offered by insurance companies, not Medicare. So you're not going to go to the Social Security office to enroll in Part D. You're going to go to a private insurance company in the state you live in. If you have original Medicare and or Medicare supplement plan that goes alongside it, you can set up a standalone separate drug plan that goes with that. Think of this as a pharmacy card. You present the card to your pharmacist whenever you're picking up your medication. The pharmacist will collect your copay and then bill the Part D insurance company for the remainder. All right. The other way you get a Part D plan is a Medicare Advantage plan. The Part D plan is built into the drug plan's built into it. In this scenario, you're going to have just one insurance card to use at the doctor's office, use at the pharmacy. Medicare Advantage plans are the only type of plan that can include a Part D. Medigap, Medicare supplements can't do that. So you have both medical and drug coverage rolled into one plan. You might consider a Medicare Advantage plan. But be sure to watch our video on the pros and cons of Medicare Advantage plans for additional information. The application process is pretty simple. So there are 3 ways to apply. Okay, and let me go over those 3 ways to apply. Option number 1 is go straight to Medicare. You can either go to www.medicare.gov and use their plan finder and type in all your medications and dosages, or what you can do is call 1-800-633-4227 after 8 o'clock at night. They're great. You'll get connected to somebody immediately. And you can tell them your drugs, your dosages, everything you need to tell them, and they will tell you exactly which drug plan they'll enroll for you over the phone. Worst way to do is just call up a random insurance company like Humana or AARP, because they're going to sell you a Part D plan, but it might not be applicable to the drugs that you take. Best way to do it, call a licensed agent or broker, independent like myself. A lot of agents and brokers don't deal with drug plans. Because there's just not much money in it. I don't care about that. I care about making sure my clients have the exact right drug plan based on the prescriptions they take. Big thing is, if you don't use an agent or broker, you're screwed if you have problems with pre-authorizations, a drug's not on the formulary. A lot of times they'll just deny it and you don't even know why. You need me, my girlfriend's a disability attorney. We'll stick her on them, and we'll get those drugs paid for, okay? And if you need any help, you can call 843-227-6725 or go to www.mayrivermedicare.com and look at all the videos and resources we have on our website, and we'll talk to you soon. Have a good day. Bye-bye.